Welcome back to the IndeVets Happy Hour, and welcome back to you, Marisa.
I'm back.
I missed you so much. I was there all alone. I had to do all the talking. It was really difficult for me.
Maybe we should do every other podcast without me then, I guess.
Oh my God, no, don't do that to me. Don't do that to me.
I heard Kelly, Amy, and Chandra were great, though.
Yeah, it was great. Hopefully you heard it today. It came out today.
Yeah, I did.
You heard your little shout out?
I did. Thank you. Yes, I had a lovely trip in Greece. It was definitely a bucket list trip. We went to Athens and Santorini, and my fiance proposed to me in Santorini.
Woo!
So,
like I said, I can't wait for the wedding. It's going to be a lot of fun.
It will be a lot of fun.
If I'm invited.
Of course you're invited, Andrew. But Jesse's number one invited. You're number two. But I drank mostly wine there. The Greek wines are amazing. And they actually have some of them in the state stores in Pennsylvania. So if you're out there and you like white wine, check out Greek white wines. They're delicious. So I haven't really had many beers. I had like one type of Greek beer called Mykonos, which is like their Heineken, pretty much. It tasted like a Heineken. But I've mostly been drinking beer. So I'm back fully strong, actually, with this. What is this? Yards. Yeah. This is a Yards, but it's called Heritage Surf IPA. It's an IPA with lime out of Sea Isle City, which my cousins have a house down there. So very local to me.
All right. Well, pause for a second. I forgot my beer downstairs. All right, I'm back. All right. Well, I'm going to crack it open. Well, in your honor, because I know you're from here, I'm drinking a beer from Conshohocken Brewing Company, Ring the Bell. It's an unfiltered Pilsner.
You love your Pilsners.
Yeah, one of my favorite types.
Maybe you can make your next TikTok of just faces of Marisa, and it'll be like me doing that for Pilsners.
Yeah, I launched my TikTok career today, which is a lot of fun.
Yeah, can you tell us about your new influencing career before we jump into this awesome pod?
So in the same vein as what we're doing with the IndeVets Happy Hour, I wanted to just bring good information to veterinarians in short clips, because I know a lot of us are super busy. We've got a lot of things going on outside of work, and on TikTok, it's fun because you can give people like 30-second-minute clips of information. So this is sort of the long form of that, and the daily TikTok and Instagram feed reels are just sort of the quickies. So enjoy them. They'll be coming out every day rather than this every 2 weeks.
You heard Andrew right. So join TikTok if you want a quickie with Dr. Andrew Heller. What are your handles?
You won't regret it. What's my handle? So on TikTok, it's andrew.heller.dvm. And on Instagram, it's dr.andrew.heller.
Awesome. All right. So what are we chatting about today?
In the last month, I've gone to 2 different conventions, CE conventions. One was the AVMA in Philly with you. You were there. Mm-hmm. And the other one was just last weekend in Minneapolis, the Vet Girl Conference. So at the AVMA, I was actually in all the lectures. And that's, if you check out my last podcast, we just talked about all the things we learned in that. And we had all the AMDs on to talk about it. But in Minneapolis, I was stuck in the exhibit room, which wasn't actually so bad. There was a lot of new stuff there. So there are 3 different new treatments that I wanted to tell you guys about.
But first, we will have this disclaimer. We are not sponsored, nor do we receive anything else from the companies that have these new drugs. We are just speaking as general practitioner veterinarians who are trying to inform other general practitioner veterinarians. P.S., guys, if you do want to sponsor us, reach out.
We are for sale.
All right. So I just do want to say though, Andrew, I'm so proud of you in this rebirth of veterinary experience and knowledge that you are bringing to me and to all of us. So keep it going.
I think I was really missing out on a lot of new information. I hadn't been to CE. The pandemic kind of sucked that all away. And now that they're back, I just tell everybody out there, you should go to them. There's a lot of new information in the last few years, and there's a lot of worthwhile learning to do. So do it.
Yeah. All right. So first one we're going to talk about.
So the first one, I love the name. It's called Zenalpha, and it's a dechra product, and it's actually pretty cool. So It's a sedative that's an innovative new alpha-2 combination drug. And what it is it actually improves the sedation experience from start to finish by using 2 different drugs rather than just one. So a lot of people are used to using alpha-2s like dexmedetomidine. This one, Zenalpha, is actually made up of medetomidine and one other alpha-2 antagonist called vatinoxin.
Just an aside there, I asked my cousins how to pronounce this drug because I had never heard of this drug, and you actually pronounced it the way they said to pronounce it, vatinoxin.
Nice.
And also, it's not a human drug. So it's actually the first FDA approval of this specific alpha-2 antagonist. So really cool.
And just to give you guys a refresher from pharmacology, so medetomidine is actually made up of dexmedetomidine and levomedetomidine. Levomedetomidine doesn't do much physiologically. Dexmedetomidine is the active part of the medetomidine. So they're combining medetomidine with vatinoxin. And if you guys know how alpha-2 agonists work, they act in the central nervous system as well as in the periphery on alpha-2 receptors. And what vatinoxin does is because it's an antagonist to the receptor, it blocks just in the periphery. It does not cross the blood-brain barrier. And so it allows the medetomidine to work on the central nervous system, but blocks the cardiovascular negative effects that we see with a lot of alpha-2 agonists by blocking the receptors in the periphery. It's actually pretty brilliant.
Fascinating. It's brilliant. I mean, how do they find a drug that doesn't cross the blood-brain barrier, right? Which is different from atipamezole or antecedent, which we use to reverse dexmedetomidine, right? Because it does cross the blood-brain barrier. So I think that is fascinating.
Yeah, it's gonna. So I think some of the benefits of this versus using dexmedetomidine alone is obviously less cardiovascular effects. It also lasts, I believe, a little bit shorter of a time. So you give it intramuscularly, and it takes about 5 to 15 minutes for it to kick in, and it lasts about 45 minutes. So it's really, really great for short procedures. I can see myself doing like punch biopsies with this kind of medication, taking radiographs, doing oral exams. I mean, anything you can do within 30, 40 minutes. And what's nice about this, and Marisa, I think you talk about this a lot, about efficiency, is that this can get you much more efficient than using dextomitor.
I was going to say, just like it doesn't last as long, it also is quicker onset as well, which is really cool.
Well, quicker onset intramuscularly for sure.
Yes.
When you give it IV, supposedly it's the same onset as dextomitor. But
it is not labeled for IV yet.
Yeah, it's not labeled for IV. But medetomidine, obviously, it's been around for decades at this point.
So really, really importantly, what animals can you use this in, and what animals should you not use this in?
It's labeled for dogs. It is not labeled for cats. In fact, the vatinoxin can cause a severe hypotension with cats. So right now, do not ever use it for cats.
Correct. Yeah. And I know in veterinary medicine, we're very used to seeing lots of drugs labeled for dogs, not labeled for cats, just because of, a lot of the times financial reasons, right? But then we end up using them in cats. But this is a no-go. This is like, don't even try it right now.
Right. The one thing is, in terms of cost, this Zenalpha is very similar to dextomitor, but you're going to save money because you won't need to use antecedent. And antecedent has an additional cost. You also save money because you can be more efficient. You can see more patients. You can get the patients out the door faster. And you don't have to use an IV catheter because you can just do it intramuscularly. So great stuff all around.
What age can we use this in?
12 weeks of age and older.
Awesome. So we can use it even for those young puppies. And are there any contraindications for us giving it, things we should watch out for as vets, or techs for that matter?
Well, you should be giving it with a syringe. But if you do get it in your eyes, if it does get on your skin or your mucosa, or even in your mouth, it may cause, obviously, some cardiovascular signs.
Yeah, and I was reading that, they say on the label, like on the insert, that you should wear gloves and goggles and a lab coat with long sleeves, especially for people with cardiovascular disease and pregnant women. And we have a lot of women in our field. And if you get this, in your skin, on your skin or any mucosal membrane, it can cause uterine contractions and decreased fetal blood pressure. So maybe, if
big
you are
warning
pregnant,
signs.
Yeah. Maybe if you're pregnant, have your technician administer this or another doctor in your practice. So Just a heads up.
And just an aside, when you give intramuscular injections, where do you like to give them?
Oh, I love this debate that we were having in our notes. Like Andrew likes to use the caudal aspect of the hind limb, like the semitendinosus, semimembranosus, and I always go for the apaxials, just because my anxiety with the sciatic nerve, which is it's very unfounded, but it's just the way I am. So I do apaxials.
And I like to live on the edge.
You do. Although I will say it's really funny. I feel like I've mentioned this before, and it may just be one of those old wives' tales that when I was using antecedent, though, I would always give it in the quad because people said that they woke up faster if you gave it in the quadriceps muscle. And so I was like, all right, I'm going to do it.
Well, that's why I actually do my intramuscular injections in the leg, because there was a study done. I can't find the study, but I was told this by my anesthesiology professor at vet school, that the speed of onset is faster when given in the semi-M and semi-T versus the apaxials. I think she actually did the study.
Oh, I was going to say, unless you produced the study, I don't believe you. But okay, moving on.
I have to find her name and find her study.
So this next one that we talk about, I know we said there's 3 new drugs on the market, but it's very, very particular that you don't actually call this next product a drug, right? We're going to call it a biomedical device. Tell us about that.
Yeah, so this next one is by a company called PetVivo, and it's called Spryng, but it's not spelled S-P-R-I-N-G, it's spelled S-P-R-Y-N-G. It's an interesting product. It's actually an injectable viscous liquid that you put inside joints, and it replaces or helps mimic what cartilage does. So this is great for osteoarthritic patients.
Probably great for your knees, right? Because you're over 40 now.
Stop. It's not labeled yet for humans. Actually, so this drug came from the human side. It was actually originally designed as a cosmetic dermal filler for humans, so basically treated wrinkles.
You should have made a joke. You should have made a joke about me using this.
That I could use because now I'm over 40. But what it does is it creates a micro cushion that self-assembles to form an insoluble, pliable matrix. And as I said, it mimics a natural cartilage. And what it is, it's made up of proteins and carbohydrates, basically purified collagen, elastin, and heparin. I believe they get it from pigs. So it's not a true anti-inflammatory. Obviously, it's not a drug, but it does reduce inflammation because of the mechanical stresses that it reduces.
I was looking this up on Vin, of course, and, there's always a thread about new drugs and have people used this. And I always have to remind myself, since it's not a, quote, drug, the way they labeled it, the FDA has no regulation on this. So, of course, we are skeptical as veterinarians. And so there was a lot out there about it not being regulated by the FDA, and also the fact that you have to give it intra-articularly. So yes. I put a note in. I was like, hip injections? Like, how am I supposed to do that? So I was wondering, is this something we're going to be referring out to surgeons, or is this something that we will learn or get trained on to do, which I thought could be cool.
The doctor, who was also one of the reps of the company at this exhibit hall, she was telling me she's used it on her own dog and she's seen great results. And we were talking about, do general practitioners feel comfortable doing intra-articular injections? And she said that they're working on some educational pieces where they can teach doctors how to do it. But obviously, when you do it, you have to use sterile prep. You have to be careful. It's a sterile procedure. You don't want to be introducing any infection into any joint.
Yeah, I could see myself doing stifles, but elbows and hips, tough.
Yeah, I think you'd have to know what you're doing. Probably surgeons that really know that anatomy pretty well.
Yeah. Well,
this particular drug can be used on any animal, in theory.
But right now they're talking about dogs. I know
and
horses. Yeah.
And it's an inert substance, so it really shouldn't trigger any inflammatory or any immune response, in theory.
Yeah. But we know how special cats are, and so they don't read the book on anything. So I'll wait to see if people are using it in cats.
The nice thing is it lasts up to 14 months.
Wow.
So, in your old dog that it's got osteoarthritis, you'll see results within a week or two.
I did look up the cost. I saw that you would put that in there too. It is about $300 for 2 mLs. And I think it said maybe for big dogs, you're at 1 ml, right? Per joint, depending.
Per joint. Right.
Because you want to use enough to fill 75% of the joint space.
Yeah. Yeah.
So when you think about how much you spend on Rimadyl or some other NSAID or, laser therapy, which I'm not saying all of those things aren't necessary as well,
Yeah.
or in combination, but I think it's fairly reasonable.
I was talking with the doctor there also about like Adequan, and she was like, yeah, multimodal, use everything. At this
why
point,
not?
Yeah, I mean, if they've got pain, discomfort, lameness, this is really going to help. And I think what's cool about it is that, this product went from humans to pets, and it may actually go back to humans if we can show real efficacy with joints. So pretty cool stuff.
I think that would be great. So awesome. So last and final product also has to do with pain control. I'm extremely excited about this one. So tell us about our last one.
Yeah, this last one, it really got me excited too. It's called Zorbium. It's a product by Elanco, and what it is it's transdermal buprenorphine that is a slow release, and it lasts 4 days, which is great on so many levels. Number one, you don't have to keep giving them meds. Number two, there's no troughs. So because it's slow release, it's constant. It's like a constant release in the skin. So let's talk about how it's, what it's indicated for and how we give it. You want to hit this one?
Right now, and obviously we know when these new drugs or products come out, they usually say they're only labeled for one thing. So this one is actually labeled just for post-op pain associated with surgical procedures in cats only. It's not approved for dogs. So, however, of course, I went on Vin just to see what other people were doing, and I was thinking to myself, like, this would be awesome for urinary obstruction. And a doctor on Vin had used it for that already and said it was awesome. This cat was super sweet, and they didn't have to bug it. And honestly, it's very cost effective, right? You think about a cat in the hospital for 3 days with obstruction, and this could be amazing. So
I think this is a little bit of a game changer. If it works the way that it's described.
I agree. And it's also labeled for 4 months of age or older, so your spays and neuters, you can use them in, and cats over 2.6 pounds. So you can use it in those kittens, which I think is amazing.
And, when you send home a cat right now with buprenorphine, usually have your technicians pull up like 1 million syringes, right? Like every dose has to be pulled up, and it's such a pain. It takes them time, and it's just cumbersome.
Yeah.
So, and it's expensive.
Yeah.
Usually it's $80, $100 to send them home with buprenorphine like that. This is a much, much cheaper option. We'll talk about that at the end, but I want to go through how to give it. So
yeah, the one thing I saw with this one, right, I was concerned because I don't remember the name of the drug, but there used to be like maybe it's out still, but there used to be a topical fentanyl. I don't know if you remember that. It was recent. And they scared the crap out of you because like you could get it on your hands a lot, right? And people could actually get fentanyl overdoses, like if they touched it within a certain period of time. So tell us how you apply this and how to make it very safe.
Yeah, so this one sort of amazed me. What you do, so it comes in a little tube, kind of like an Ocernia or Claro, right? It's like a little tube. And they make 2 different sizes. So there's one for smaller cats, 2.6 to 6.6 pounds. There's another one for the larger cats, 6.6 to 16.5. And basically you apply it just like you would apply Revolution.
Wait, but time out, Andrew. What if the cat's 6.6 pounds?
I would probably go with the higher dose. Because buprenorphine is very safe.
Yes,
and it's got that ceiling effect, and it's really difficult to overdose any patient on buprenorphine. So I'd probably go with the higher dose just in case. But
good point.
So all you do is you part the skin. So you do not shave it. You don't have to wash it. You just part the skin right in the back of the neck, and you squeeze it on. And you really got to make sure, because this is transdermal, and humans can go through our skin as well. You've got to be wearing gloves when you do this. This has to be done in the hospital. And they, as you said before, you should probably wear gloves and goggles and even a lab coat. You don't want to get it on your arms or anything like that. But basically, you just apply it on, and you put the cat in a cage or a crate, and you leave the cat there for 30 minutes. In 30 minutes, it's completely dry, and then it's safe to handle the cat.
It's crazy.
And it's going to kick in 1 to 2 hours.
Yeah.
So if you've got the patients dropped off in the morning and you're doing a minor procedure, you could, in theory, they even said you could use this for your surgical pain if you use buprenorphine. I tend to like a stronger mu agonist for surgery, but there are a lot of practices and a lot of doctors that like to use the partial mus like buprenorphine. So in 2 hours, it'll be kicking in.
Yeah. And I, again, looked on Vin, but some of the anesthesiologists obviously are, like you said, and I agree, those full mu agonists like Hydro, you can use them. And then you apply the Zorbium 2 to 4 hours post-hydro. So once the hydro wears off, the buprenorphine takes over. And then a lot of people were asking, like, well, how do I use this if I use Kitty Magic / DKT or whatever for these cats, for these neuters and spays? And the great point was, use DKT and then in an hour apply the Zorbium. They're already immobilized at that point or in recovery, and then it just takes over. So this is game changer. You're right.
Yeah. Although, in theory, the Torb, doesn't give much, analgesic effect. So I would even consider just using the DK aspect and using the buprenorphine beforehand. Put it right on their skin and just use that, because you may get a better effect that way.
Yeah. Problem is it doesn't sedate really well.
Yeah.
So yeah. We'll have to see. We can
play around with it. It's safe. One of the best things about it, and I don't even know why it's this cheap, it's $10 to $15 a dose. So for the smaller dose, it's about $10. For the larger dose, $15. That's 4 days worth.
4 days
of buprenorphine. 4 days worth. That's obviously the vet cost. So however you want to mark it up, but it's already available through your distributors. I checked it out through my distributor. Or is it not?
No,
it was on there.
It was on there, but it said check back soon when I looked at mine. But I think so obviously we've tried a lot of other long-acting buprenorphines right now. There's the compounded one, and then there's the Bup SR. What about this is super cool is the only adverse reaction was like mild hyperthermia. It didn't have the significant like anorexia or behavior changes that we've sometimes seen in other long-acting buprenorphines. So that was really exciting to me as well.
And the fact that it's slow release. Whereas I think the long-lasting one, they give you basically a very large dose, and it just lasts a long time.
Yeah.
So this is actually a slow release. So you're actually giving the pet the amount it needs throughout that 4 day period.
Yeah.
I wonder what happens after 4 days. Like, does it just like go down like completely, or is it still in this? Is it just like slowed, or is it all used up after 4 days? I'm not exactly sure. It's something I'd probably want to ask one of the reps.
See, guys, we always have questions because no one knows everything, especially us.
Well,
but no, that is a good question.
So we had just to summarize, we had Zenalpha, which is just for dogs. We have Zorbium, which we just talked about, which is just for cats. And then we have the Spryng, which you can use for any.
But maybe start with dogs.
Start with dogs or horses, if you have horses.
That's true.
If you can get into a cat joint.
Yeah. Well, I guess I have to brush up on my joint intra-articular injections right now. So. Yeah.
Well, I am loving all this. Yeah, I'm loving all this learning, Marisa. I got to tell you, I'm learning, and I'm gonna be teaching. So stick around.
Well, I mean, I think you can make about 5 TikToks out of all of this information. So.
Probably. This is going to be some good stuff.
Guys, don't forget to follow, like, subscribe to not only this podcast, but Dr. Andrew Heller is an influencer now on TikTok and Instagram. So
I'm an aspiring influencer.
What happens when you get on TikTok as an influencer after 40?
Actually, I had people already, just from one post today, like I already had people reach out to me, like friends that I haven't talked to, like, hey, I saw your video. Pretty cool, man. So
there you go. So stay tuned. Actually, we're going to try to be, I'm going to put it out there, we're going to be producing more podcasts. And so next week, we will be with Dr. Casey Robinson, our fabulous general practitioner who loves eyes, for his last in the series, where he lets us all know what major eye meds every general practice should carry. So thanks, Andrew. It's good to be back.
And we'll be finalizing that Opthos series. We've had him on for 4 or 5 episodes now. So
yeah.
It's been great having him.
Yes, it has.
We hope you enjoyed this episode on the IndeVets Happy Hour. Thank you for listening, and tell your friends, vets, techs, general public. If you like us, leave us a 5-star review, and make sure to subscribe so you can be alerted whenever we have a new episode. If you have questions, comments, suggestions for future episodes, you can email us always, clinical@indevets.com. You can find Marisa or I there.
Also, to learn more about us and how we're making VetMed better, head to IndeVets.com. That's IND as in dog, EVETS.com. While you're there, be sure to head to our blog for the latest stories and tips from our doctors. See you next time.
Cheers!
I'm a veterinarian, sure, but I'm way more than that. I am also a tango dancer, a struggling but determined pie maker, and a mom. With IndeVets, I get to choose when and where I work. I create my own schedule and choose shifts at nearby animal hospitals that are right for me. Having that flexibility is exactly what I need to have plenty of time for all those other things that I am. Because I'm more than just a vet. Visit IndeVets.com to learn more and apply.